The five that I have featured here on the screen are the ones that we have our cannabis-derived terpenes featured in. So, and a lot of these will help with a lot of the ailments that we were talking about today, like sleep, anxiety, stress. Um, so to start, we have the Kind soft chews. So those are crafted with all natural flavors. They're vegan, gluten-free, and they're infused with terpenes. These come in a package of 10 with 10 milligram soft chews. And the patient favorite that I have featured here is a 1-to-1 black cherry. So when you do a 1-to-1 THC to CBD, you get an entourage effect of the cannabinoids there that really give you a nice effect both for sleep, anxiety, and stress. And in the black cherry, we specifically have terpeneol, humulene, and terpenoline. Sorry, they are a mouthful, so if my pronunciation sounds a little funny, they are a little funny. um, Moving on, we also have our Camino soft chews. They're again infused with terpenes and all natural flavors. Our patient favorite for this line is our Camino Midnight Blueberry. So those have a 5-to-1 THC and CBN, which increases the sedative and relaxation effect for these particular gummies. With these, the top terpenes are beta caryophyllene, linalool, and myrcene. So you also get a good pain relieving effect from these. All of our kind flower goes without speaking. You are going to have terpenes in your cannabis flower. The best way to find out what terpenes are in each batch of flower is to ask your bud tender. So of course, this takes, being present, or you can also call in and ask about the different batches that we have available in store. And our bud tenders or patient care team can always give you that terpene information so that you know exactly what's in each strain and the percentages.
You also have a pretty good. I like your RSO capsules. In other words, RSO, which is Rick Simpson oil, or but it helps be able to take what they call the whole plant and bring it to
Exactly.
bear. So you're getting all of the terpenes and all the cannabinoids, and these are very effective to help with not only just pain but also with sleep. That's safe to
Oh,
say.
definitely. Those are probably one of our patient favorites for in sleep and insomnia. They come in both 10 milligram and 30 milligram capsules. Of course, the 30 milligram you'd want to save for your seasoned users because that is a strong dose. But we do offer it in the 10 milligrams so you can kind of increase as needed. And like you said, Mark, it has all of the plant fats and all the plant properties that really give you a full spectrum effect and really help with that sedation and relaxation to sleep through the night. Lastly, I also featured our Kind tinctures here, which do have terpenes included. A patient favorite is going to be the blueberry. Again, it's an indica. This tincture has linalool, beta caryophyllene, and beta myrcene, which are all sedative and pain relieving terpenes. So
Sure.
when you go to an Air Cannabis dispensary, feel free to talk to our bud tenders. They have all of their terpene information for each product so that they can share with you when you know exactly what you're looking for.
Right. And what I like is all of your products, you're very upfront about the terpenes that are out there. And even, for example, even your edibles have terpenes in them, which a lot of dispensaries don't have terpenes in their edibles. And I think that's really, really key. It's one of the advantages. So
Thanks. Yeah, we're really proud of them.
cool. Cool. And Amy, you're going to have some loyalty programs and some giveaways, aren't you?
Yeah, we'll have some features. I believe, I don't know if we have it on a slide now or if it's coming next, but we do have some giveaways. We'll pick 3 winners from today to try our Kind soft chews for free. And then
Hmm.
we also have a free coupon offer. There it is. So everyone that's here today can redeem the offer for $25 off. There's no minimum for that. So it's just a free way to try our products You can try any of the ones I just described or anything else that's in our store. And just present that code if you want. You can take a picture of the screen right now, and then you can show that to your bud tender or just tell them the code on the screen, the Terpene webinar $25 off. And that is
Great.
good until July 5th.
So that should help people at least address their condition and do it at a great rate and get to no error. So
Yeah, give us a try, and then you'll be able to see for yourself if those edibles or whatever you may try is right for you.
great. Well, thank you very much. Um, let's jump into this. Let's jump and talk a little bit. Manny, can you tell us? I'm sorry. We're going to jump into some of the pre-submitted questions first. So let's jump into that. One of the questions are terpene profiles absolute, i.e., two hybrid strains from different manufacturers but labeled with the same name. What's interesting is we have a saying in the industry, Jack Herrera is not Jack Herrera is not Jack Herrera. And that's, by the way, a strain that's grown by almost every dispensary, but they do have slight differences. Maggie, you might want to address this. You have different terpene profiles than people would potentially find with other manufacturers. That a lot of it has to do with the fact that your product is botanical. In other words, you're growing it. And so as you're growing it, each flower has its own personality.
Correct. So every grow is going to be different. So typically you will maybe see similar terpenes, but in different levels, or maybe a more predominant terpene in our, let's say, Jack Herrera as an example, compared to another dispensary's version of it. Also, it can change batch to batch in the levels of the terpenes. So even for our grow, one batch of our flower may have a high level of myrcene and the secondary be linalool. And then the next time, the next batch that comes out, the linalool may be higher than the myrcene. So it does vary from grow to grow and from batch to batch, or harvest to harvest, I should say.
Sure. And I think it's important to point out that the terpenes are absolute. In other words, these are consistent as terpenes themselves, but the cultivars, the actual products themselves, may vary. They may vary in the terpene profiles. And that's really what the COAs are all about, to be able to find that. So hopefully that answers that particular question. One of the questions that comes up is, what terpenes help with anxiety and or depression, but suppress appetite at the same time, trying to fight the munchies? Manny, this kind of fits up your alley, right?
Sure, I'd be happy to tackle this one, Mark. So when you're dealing with terpenes and anxiety and or depression, but want to suppress appetite, that's always a challenge because, as most know, when you're dealing with cannabis or marijuana, usually you get the munchies. However, that said, most persons who deal with anxiety and or depression are usually dealing with hybrids or indica dominant hybrids in order to combat that anxiety. Instead of looking at the categories, indica, sativa, and hybrid, looking at the terpenes as the question states, I would probably go with B-caryophyllene and limonene for anxiety and depression, because it'll work hand in hand for the daytime. And if you're looking for some nighttime anxiety relief and or depression relief, I would stick to linalool, not so much myrcene. Myrcene is going to be a little bit heavier than linalool. And then add in caryophyllene and maybe some pinene or limonene. The order in which these terpenes come in is very important, which is why what Air does on their website, labeling it with the percentages, is so important, because you can see what order they come in. So again, anxiety during the day, I would use limonene and caryophyllene. In the evening, linalool and caryophyllene.
Right. And it's most important to point out that humulene also helps to suppress the appetite, and that's one we may want to take a look at as well. Great. One of the other questions that comes up is, what terpene is effective for hand tremors? Now, I know that in many cases, when you're looking at hand tremors, CBD is actually pretty good with that. CBD, but you need some THC with it. Your thoughts on this? Manny? What would you recommend?
So when you have those type of tremors, it's typically neurological. To your point, Mark, CBD probably be better. However, you still want to get a specific terpene profile. And usually linalool, B-caryophyllene, and not humulene, terpenylene would be beneficial in CBD and or CBD THC products.
That should help you quite a bit. And cannabis does work very well for hand tremors. I know it's very effective, for example, for Parkinson's patients and for people that are just getting over arthritis. Let's grab on the next question. How do terpenes affect how do terpene effects differ from those of the THC content? This is kind of interesting because in many ways, THC is dictated by the cannabinoid, and the terpene is really riding that train with the cannabinoid to be able to provide the effect. Do you want to comment on this, Manny? Because you have a lot of experience in this area.
Yes, so terpenes kind of drive the bus, as you stated, and I like to use an analogy: spaghetti and meatballs. In this instance, if we all went to an Italian restaurant and we all ordered spaghetti and meatballs, the chefs will give us spaghetti from the same exact pot. That'll be your CBD, if you will, and then meatballs from the same exact pot, your THC, if you will. And if we all looked at it, smelt it, tasted it, pretty much be the same across the board for all of us. However, then we add our sauces and our seasonings and everything on top of that, and that changes the palate altogether. And that's what terpenes are. So you get the effect from the meal, you get full, it sustains you, you're not hungry anymore, but it's much more pleasurable on the palate depending on what sauce and spices you put on it. And that's what terpenes are to cannabinoids. The terpene is so much more important, not more important, but just as important as THC and or CBD content.
Sure, that's really, really great. Next question is, will cannabis effectiveness increase overall when combined with plant-based foods that are similar terpenes, i.e. eating a mango for extra myrcene? The answer is yes, and maybe Maggie, you want to be able to comment on that.
Yeah, so the rumor is, and the research shows that combining things like mango, for instance, with either edibles or flour that has myrcene in it can kind of double that effect or help increase that onset. So there is some truth behind that we've heard before. And I believe it also, I think you mentioned it in your slides just a moment ago, that the same goes for chocolate, I believe it said in the video. So if you can match your terpenes to the things that they're related to in the real world, then you're definitely able to kind of increase that use.
Yeah, if you can home in on, for example, mango has a lot of myrcene in it, that would help quite a bit. But also, as we mentioned, terpenes like fatty foods. This is where your peanut butters comes in. This is where your chocolates come in, and that type of thing. That's why they're very effective in edibles, because it really you get the fat and you get the terpenes put together that really help quite a bit. So the answer to your question is yes, it will. And both the research and also people trying it have actually reported that it does have an increase. Next question, it says, I'm taking 3/4 of Soothe Dropper for RA, but no relief. What do you recommend? I think, Manny, this kind of falls in your category.
Absolutely. So Soothe is a 1-to-1. It's as you can see there from the terpene profile, caryophyllene, limonene, and pinene. Top three are usually what I go with. And you should be getting some pain relief. That being said, it also needs to be known that terpenes are also, or terpenoids are also the most volatile molecule when consuming it particularly. So if you're using a tincture or edible, the best bet is to try to have something fatty, a small little snack just before, or take your product just before a big meal. So that way it has that fatty product in your gut in order to absorb. The other thing you want to do is try to hold it under your tongue sublingually as much as possible, because that way you get that absorption through your mucosis in the mouth and better terpene profile efficiency. Because as soon as it hits the stomach acid, it's pretty much going to deteriorate those terpenes, and it's
Sure.
always going to be kind of indica or a heavy sedative-like effect when you're consuming it.
And another option is you may want to take a look at a product that also has a higher CBD ratio, maybe a 4-to-1 or 8-to-1.
Absolutely. I would even go as far as to recommend that 5-to-1 gummies that Maggie was describing earlier in the slides, because CBN is very hard to find in the market right now, and it's also very delicate on the body compared to THC. So that might actually help as well.
Yeah, that's great. Thank you. Next question is, how about lupus? This is an interesting question. Manny, you want to tackle that one? Or you want me to grab it?
I'll start off if you don't mind.
Sure.
So lupus is a kind of unique situation. I have an aunt that deals with lupus, and I found that topicals work better for her rather than ingesting. And topicals, typically you won't get much of a terpene profile that gets into the bloodstream on the topical. So I would definitely combine a topical along with some type of other route of administration, whether it's inhalation, sublingual, edible, or otherwise. That way you're attacking it on two fronts. But the terpenes I would recommend would be caryophyllene primarily because it also acts almost like a cannabinoid, reacting with our receptors a little bit stronger than most terpenes.
Mhm.
And then depending on day or night, we would go with limonene for the daytime and myrcene and or linalool for the evening or nighttime.
Yeah, that's good advice. And as you mentioned, topicals work very well for that as well. And don't overlook those because I think people don't realize that topicals they absorb into your skin, but they also can be transdermal, meaning they absorb into your bloodstream, depending on the type of product that you're using, and that can be very effective. So take a look at that as a potential option that's really there. Let's jump into the next question. It's a really good one. What are the best product, or what is the best product to use to if you have cancer, terpenes, route of administration, et cetera? Does it change with the type of cancers? Let's see. I'm going to start this by maybe, Manny, do you want to try to tackle this one to start with?
So I like the way you and Amy mentioned it previously in the slideshow that it's not so much the type of cancer, it's treating the symptoms of the treatment, treat the treatment as you stated, Mark. So
Hmm.
depending on what you're dealing with, you would walk into an air or a different dispensary and have that consultation because everybody's treatments and symptoms of those treatments are going to be slightly different. And
Hmm.
depending on what that is going to be, is going to determine what route of administration you want to use, what products are available in that route of administration, and then the best products to use. But if you're a cancer patient, you definitely want a journal because a lot of it, unfortunately, would be kind of a hit and miss. You're trying to figure things out to begin with.
Hmm. Yeah, I think it's really important. It's not it's effective for all types of cancer. The question becomes, if you have cancer, what is the particular condition that you're really looking at? Is it pain relief? Is it something where you're trying to manage the chemotherapy, stopping the proliferation of the cancer cells in the tumors? Those are kind of things that you want to pay attention to. But cannabis works well. And I would say I would take a look at that. Now, when you talk about the routes of administration, this is very personalized, I think, because some people don't like to smoke cannabis. Some people do. If you are into smoking cannabis, you want to make sure that you get the right temperature. Just taking a joint, lighting that blunt, and putting a 500-degree temperature to the end of that blunt will burn off most of the cannabinoids, almost all the terpenes and all the flavonoids. So you're not getting a lot of medical benefit. That's why vape pens, dry herb vaporizers are very, very popular because you're actually steaming the product and you're being able to bring out the terpene profiles. That's something that's really, really important. But I also think don't overlook some of the terpenes that you can get from the tinctures as well as the gummies. Maggie, do you want to make a comment on this? Because you have some products that you might want to focus on this.
Definitely. So, while I can't say what the best product is for this particular person or their case, a lot of cancer patients have found relief using RSO, which we mentioned before, our RSO capsules. They
Right.
also come available in syringes so that you can, make smaller doses or use it in a different way. Having all of the plant,
I should point out when you say syringe, it's not something that you take a shot. It's like in a little
no,
syringe, but that you're able to it's because it's very thick and you can squeeze out a little bit. And usually when you squeeze out a little bit out of the syringe, it's about the size of a grain of rice. Is that correct?
correct. You can usually start with a very small amount. And you're right, this is not your typical syringe. It's no needle involved. It's just to hold the concentrated product.
Sure.
So RSO with all of its properties gives a really full spectrum healing effect that a lot of cancer patients have found relief from. So
Yeah.
I would say that would be one that I would strongly look at. And then terpenes that can help with symptoms and side effects. I think we've already mentioned all of them here. The limonene, myrcene, and
Mhm.
borneol were the top ones that I was going to also mention. So
Right. And you have what's nice. I really highly recommend RSO when you're looking at cannabis cancer. I do have to point out though, RSO is what I consider to be the 151 Bacardi of cannabis. It is strong because it's whole plant, all the
yeah,
cannabinoids and all the terpenes. Now, I do want to point out that it is very, very effective. But you also have RSO not only in the syringe, but you also have it in a capsule and a capsule form as well. Do you have it as a tincture?
Yes, we do have RSO tinctures available as well. So you can even dose yourself differently, depending on what you're looking for, and change that onset just a little bit by changing the route of administration.
Yeah, and I do want to mention my mother was diagnosed with cancer about 6 years ago. We put her on a regime of medical cannabis rather than getting any operation. The doctors wanted to operate on her, and we said no. It turns out that her over a period of about 6 months, her cancer that what they were worried about shrunk to a point where she's now in remission, and it works. I mean, it's very effective. Now, what we used RSO. And we did is we gave her the RSO just prior to her going to sleep, about an hour or two before she went to sleep. She slept like a baby, and she didn't have to worry about the effects because RSO can be very strong. She didn't have to worry about working or driving or things like that. So it's something that the timing of taking the RSO is really, really important as well.
If I could add to that, Mark, I just wanted to point out that RSO is also not to be inhaled. I know a
Good
lot of
point.
people do attempt to do that. It's full of the lipids, the fats, the chloroform, and everything of the plant that is not necessarily too dangerous for you, but it can create irritation and harm you. So do not inhale RSO. And the fact that it's in a tincture is so phenomenal because, as I mentioned before, holding it sublingually under the tongue, you get better terpene absorption as well as cannabinoid absorption, giving you a better effect and easier dosing.
Sure, sure. So you have a couple of different options with cancer, and don't be shy. I mean, you have cancer; it's scary, and we know that. And so, but I would attack it. I wouldn't necessarily let it. You want to get ahead of the curve on that particular one. So please take a look at some RSO products, and again, find out what works for you. Find out the dosing and the timing of that. One of the other questions is that I live with chronic pain from a degenerative disc disease, scoliosis, stenosis, and painful neuropathy. Best terpenes for nerve pain. Manny, what's your thoughts?
I will always go to caryophyllene for pain, whether it's nerve pain, chronic pain, site pain. Caryophyllene, again, is one of the terpenes that acts like a cannabinoid. It binds better with the CB2 receptors, but also with the CB1, and is great for inflammation, which in turn relieves pain. But you're looking for the combination of terpenes. You're never going to find just one specific terpene. It's a recipe of ingredients for the entourage and or synergistic effect.
Mhm.
So using a topical, different routes of administration, a topical along with an edible for long-lasting effects, or a vape for that breakthrough relief. It all depends. Have that consultation with a dispensary associate, and I'm sure they can direct you. But caryophyllene is always my number one for pain.
Right. That's good. And plus, most of the terpenes, in fact, all the terpenes do address a lot of these areas. I have herniated discs in my neck. I have 7 of them, which is very painful. And I use a combination of tincture drops as well as vape in the morning to be able to just get my day started and dropping my pain level down to below a 1. I think that's very, very important. You can mix and match the routes of administration, and I think that really helps quite a bit. Let's jump into the next question, which I think is really interesting. What is a good terpene to help quit smoking? I've not seen any studies on this. Manny, have you seen anything on this?
I haven't seen any on the terpene profile. What I did find though is, as most may find, is the actual habit of the timing and the method of which you smoke, which is obviously by your hand. So that method of smoking a cigarette, having that in your hand, getting a fidgeter thingy tool, I forget what they're called, but you
Mhm.
those little fidget spin wheels,
Yeah.
and then using a vape, I found helped me pull away. But I also was distracted by my other ailments. So quitting smoking was a benefit of me helping myself in other ways. I wasn't as mindful to it, but it's more of the habit, as well as the timing I haven't seen any studies on terpenes particularly.
Yeah, I don't know if we can effectively answer that question with any scientific or any medical research that's done. I'm not aware of that, but I do know that one of the things about cannabis is it has a calming effect, and that really helps people when they quit smoking to just basically calm down and be able to put themselves in a good place. Maybe that helps quite a bit. Let's jump into the next question. It says, I have hyperthyroidism, fibromyalgia, and high blood pressure. I don't achieve relief from anything I've tried. What terpene is best what else should I look for? Manny, what's your thoughts?
I think this is more of routes of administration and probably doubling up. Hypothyroidism, fibromyalgia, and high blood pressure all kind of fall hand in hand in one case besides the hypothyroidism. But
Mhm.
fibromyalgia, as you described in one of your slides, it's very personal. The symptoms could be all over the chart. I would probably use a patch, some type of transdermal, to help fight that. As far as the high blood pressure, that could be also coming from the stress, the anxiety, the pressure that you're dealing with, the anxiousness and frustrations. As far as the hypothyroidism, I'd rather not speak on that one directly as I'm not a medical professional, so I'll defer that one to you, Mark.
Yeah. Well, I think that again, going back, what you're talking about here is hypothyroidism. Again, it'll affect the fibromyalgia and the blood pressure. You want to stay with something that's very calming. You want to stay with something that addresses the pain, and you want to stay with something that really helps quite a bit with your inflammation. And so, I really think that looking at the cannabinoids that really work, not only cannabinoids but also the terpenes that work with those work really, really well. And I think you're right. Caryophyllene is one that you want to pay attention to. I would pay attention to myrcene in this particular case. And don't forget linalool. I think linalool will help quite a bit in this particular case as well.
To that point, Mark, we also want to remember that looking at the terpene profiles is only looking at half the picture. So we want to look at the ratio, the route of administration,
Right.
CBD to THC and terpenes. It's
Right.
not just one specific thing. We're looking for that entourage and synergistic effect.
That's a good point because you may want to increase the amount of CBD that you're using, have a 2-to-1, 4-to-1, or 8-to-1 type of a product that you're going to be using. That can help quite a bit. That'll help. You're right. It's a combination. Starting with the right terpene and then finding the right ratio really makes a big difference. Let's jump into the next question. It says, is there an easier way to find the right flower without looking at every single COA? That can take a long time. Maggie, maybe you can answer this because I think the best way I found to do this is just go to the dispensary and ask the bud tender. They'll give you all the information. In fact, they'll not only have the COAs, but they can probably recommend they cut down on your looking and give you the right flower and be able to look at the right products right up front. Your thoughts, Maggie?
Definitely. If you're able to, going into the store and talking to your local bud tender is going to be your best bet. Most of them have tried all of the products. They can make really good recommendations, and they also have all of that information there. So if you want to know what terpenes are in, a specific strain, they usually have a binder, a book, or a way to look it up. And this is not just air, this is other dispensaries as well, because I shop based on terpenes myself. I do ask when I go into stores, and most of them are so used to customers and patients asking for that now that it's pretty common for them to have it available. So number one would be going in. Secondarily, if you're placing an order online and you're having it delivered, you can always call and talk to the patient care team and they can do the same for you, although sometimes it might take them a little bit longer. That's, a second option if you're not going into the store.
Yeah, I think that's good advice because I think you're right. Trying to search for every COA, it becomes difficult. I think talking to the bud tenders will be able to help quite a bit. And stay tuned because in the fall we may have something that helps answer this question as well, making it
Well,
a lot easier.
on
Go
top
ahead.
of that, Mark, I've also, again, I got to give compliments to Air. Having those terpene profiles and percentages on their website is basically the COA that you're looking for. A lot of people are looking for those terpene profiles, THC and CBD content, and that's all they're looking for, and that's perfectly fine. That's how I shop for the most part. But not all dispensaries have that. Although going to talk to an associate at a dispensary is always best, having that stuff on your website like Air does makes it so much easier to shop online as well.
Yeah, that's a good
Thank
point.
you so much.
Yeah, that's a good point. The next question is, can you talk about caryophyllene interacts with CB2 receptors? Well, it does. And the interaction that it performs is it basically takes that receptor and calms it down. What it does is lets that receptor get back into its natural state. Manny, do you want to talk about this a little bit? Because you're a fan of caryophyllene.
I am. I'm a big fan of caryophyllene and the receptors, the entourage effect, and everything. Our endocannabinoid system. So basically, what happens is you have primarily CB1 and CB2 receptors that are the most talked about. CB2 receptors are in the spinal cord and in the brain, but more prevalent in your peripherals. CB1 receptors are more prevalent in your spinal cord in your brain, which is what THC reacts to, which is why you feel that euphoric effect.
Mhm.
Now, caryophyllene works more like the cannabinoid, creating chemical communications rather than kind of influencing it like the other terpenes do. And when it passes by a CB1 receptor, it's kind of like depending on what am I in the mood to eat tonight? You're driving down the road, you see a restaurant, that sounds good. Now I'll go to the next one because you see your favorite one down the road. That's the CB2 receptor that caryophyllene reacts with. And to your point, Mark, if you're dealing with inflammation, if you're dealing with pain, if you're dealing with whatever specific diagnosis that you're dealing with, caryophyllene is going to help that CB2 receptor go back into its homeostasis and not overreact that way. And that's
Yeah.
a perfect diagram that just popped up. You can see how CB1 is more prevalent in the brain and the spine, and
Mhm.
CB2 is more on your peripherals. And
Good.
caryophyllene just works best. And you can also find it in black pepper, by the way. So if you like
That's
pepper on your meals, dose it on.
and if you can tolerate chewing black pepper on it by itself, which is a real challenge. That's a good explanation. Thank you very much, Manny. Next question is, what do you recommend for Parkinson's? And I know there's been some recent studies coming out showing the effectiveness of Parkinson's and THC. High ratio CBD with THC has really helped quite a bit with Parkinson's, but also it has to do with a lot of the terpenes that are there. You want to comment on this, Manny?
Yeah, so when you're dealing with Parkinson's, it's somewhere going to be more neurological. CBD works best, but it can take a little bit of time. And to get off of the cannabinoid train for a second and get onto the terpene train, again, using specific primary terpenes like limonene, myrcene, linalool, terpenoline, caryophyllene, those are your primaries that you want to look at. And if you're looking for daytime control, limonene, I found from the recent people I've worked with, works best for Parkinson's as it
Mhm.
helps with anxiety, stress, and inflammation, but it doesn't give you the energy like pinene would as a terpene. So you want to avoid pinene, stick with limonene during the day, and then linalool early afternoon, early evening, and then myrcene towards the night. And you can get that in CBD products and THC products. But for Parkinson's, most will start off with the THC as they preload with the CBD because that could take a couple of weeks for that to take effect. And
Sure.
then you'll see the seesaw kind of go the other way and primarily using CBD with specific terpenes.
Yeah. Most of the research that I've seen says Parkinson's, when you're using medical cannabis, it could take between 2 to 3 months of use before you see the dramatic effects that you're really looking for. It takes a while because Parkinson is candidly, such a tough disease or condition that really what you really want to do is you want to be able to let the medication attack and overcome a lot of the symptoms from Parkinson's. It's not going to get rid of it, but it'll get rid of a lot of the tremors, and it'll also get you in not only a better mood, but also be able to let you get a lot of your life back. Your thoughts, Maggie? Do you have any comments on that?
I was going to say basically the same thing you guys said. I really recommended terpenine, pinene, linalool. All are good for anxiety and helping to calm and soothe that nervous system,
Mhm.
which can really help with Parkinson's. And
Yeah.
I agree, it does take some time, especially when using that CBD in your regimen. It takes time to build in your system to
Mhm.
really help with the anti-inflammatory, properties.
Sure.
So I have seen some patients who were unable to walk in the door at times. A few months later, after, using this medicine, they were able to walk in and not have the tremors that were preventing them from before.
Sure. That's great. Next question is, I've always assumed terpenes were just flavorings. Well, they do provide some flavor. There's no question about that. So do the flavonoids, but really the terpenes and the flavonoids provide a lot of the medical benefits and from cannabis. Do you want to tackle that one, Maggie, as a first start?
Sure, of course. So, like you said, they do provide flavor. They're commonly found in a lot of spices, flowers, fruits. So they do provide the flavors and aromas that are unique to each plant. However, there's so much more. They provide really all of kind of where we were talking about before, like how important is it compared to THC? And really, like THC is almost the fuel pushing the rocket, and the terpenes are steering the direction of which way they're going and what effect they're going to have. So,
Mm.
like you said, Mark, it is flavors, but it's a lot more there.
Well, look, just because you have a pretty face doesn't mean you can't play the sport. It's more than just flavoring, and that's what's really, really key. Manny, your comments, because I think this is critical.
Yeah, absolutely. The same thing Maggie said. The one thing I would add to that, or a couple of things I would add to that, is we have our olfactory system or our nose that smells things. And if you've ever had a cold or got sick where you can't smell anything, you also lose a lot of appetite because you can't smell the food you're eating.
Mm.
So the terpenes, they do add some flavor and they do play on our olfactory system, which kind of tricks the mind into feeling or tasting something. Um, but at the same time, the flavonoids play a big role in that as well. The
Mhm.
flavonoids give a little bit here and there, just a little bit off. And then you also have what you call cannabis derived terpenes and
Mhm.
botanical derived terpenes. And cannabis derived terpenes come from the plant that they started from seedling all the way to the end product. However, it's very hard to capture those terpenes because they're very volatile depending if it's ethanol, if it's CO2, chromatography, my preferred. So it's very hard. And a lot of the times, specifically if they're trying to develop a new chemovar strain or a particular flavor, they would get quality botanical terpenes to add to that so they can make sure they have a consistent product each time the patient comes to shop.
Sure. That's really great. Let's jump into the next question. It says, are terpenes the stuff that gives TruePod vape oils its flavor? Now, that vape TruePod is from True Leaf. I believe I'm not an expert on TruePods. I'm not an expert on on their products, but just as an educated guess, I would think that is one of the things that gives it its flavor. Your thoughts on it? Your thoughts on that, Maggie or Manny?
Maggie, if you'd like to go first.
I'm not familiar with their products, so I can't say for certain, but I'm assuming it is terpenes. It's just I'm not sure if they are cannabis derived terpenes or botanically derived terpenes, which we kind of just touched on. Botanically derived are coming from the fruit, flowers, spices, and such, whereas cannabis derived is coming from the plant.
Yeah, I would say there's an educated guess. I'm not an expert, so this is not a definitive answer. It's more of an educated guess, and that's the best we can do. I'm not an expert on the True Leaf
I'll
stuff.
touch on that a little bit, Mark. So the Department of Health for the state of Florida does not allow flavoring. Everything has to be from seed to end product, and botanical terpenes, because a terpene is a terpene is a terpene molecularly, is allowed to be added. So typically, again, an educated guess, I can't say definitively. I'm not a representative of a True Leaf. However, any flavor you get from any of the products from any dispensary is typically going to be because it came up from a botanical derived terpene for that specific flavor.
Yeah, that's a good comment. That's a good comment, Manny. Thank you very much. Let's move on. So these are the questions that we've received during the webinar itself. So the first question is from Anonymous. I have neuropathy, not necessarily pain, but numbness and tingling. It makes me twitch constantly while sleeping. Which terpene works for twitching spasms? Thank you. Manny, you want to take this one?
Yeah, and I'm actually going to take from because I'm so excited, I can't wait to go get some the 5-to-1 THC CBN chews that Air has. I think would be particularly beneficial, not only because of the terpene profile that it comes with, but because it will act as a sublingual as a chew. You'll get the absorption under the tongue. And sublinguals and edibles, typically though the onset could be 30 minutes to 2 hours, will
Yeah.
last somewhere between 4 to several hours, which will help you sleep through the night instead of having to wake up and having to vape or having to smoke or having to do something like that over and over. But terpene wise, myrcene, linalool, caryophyllene, and then definitely in a sublingual form, that 5-to-1 THC CBN product, I think would be very beneficial for you.
Right. Right. Good point. Mercedes asked a very good question. Most terpenes I see at my dispensary don't list the terpenes it has. How do I find out what terpene a product has? Well, naturally, you can ask the bud tender at the dispensary. They should be able to answer that question for you because they should be able to give you a COA that has the terpenes that are in there. Now, I do want to point out I prefer to work with a lot of the dispensaries that are right up front about the terpenes that are out there. I'm not slamming this dispensary that you're using. All I'm simply saying is I like the dispensaries that let you know the terpenes that are there, list what's there, the percentages, and really help you guide you through that. I think the best thing to do is just ask the bud tender. Your thoughts on that, Maggie?
Agreed. Like we said before, definitely asking your bud tender is going to be a great option. Otherwise, like Manny said, we do have ours listed for the most part on all of our products on Air's website. So that's another option. But if you are, not close to one of our stores or you want to stay with the store that you're at, definitely just ask the bud tender and they should have those available for you in store.
Sure, that's great. Manny, any comments on that?
I would just add on to it that they have to have it available per DOH, Department of Health. Per request, they have to have it available, particularly if it's not available online.
Mhm.
And most dispensaries will have like a little book put behind them. Just be mindful of the dates on them. It's very hard to keep up with as batches come out weekly, if not daily, to the dispensaries. And this is a live product, so batches do change from batch to batch. However slight, whether it's 0.01%, they have to print out a new COA for that and have it retested. So just be mindful of the date, but it's always available upon request.
Sure. Great, good question. Let's jump to the next question. It says, Anonymous asked the question, is there a relationship between the terpenes are found in indica products versus sativas? I've noticed that a lot of the indica products are higher in myrcene. So the answer is they all have terpenes. Indica and sativa products all have terpenes. The question is what ratio, and a lot of the ratio of the terpenes indicates whether it is an indica in the couch type of a product or sativa, which is an energizing product. And again, myrcene is one of the bellwether terpenes that helps you determine that. Your thoughts on that, Manny?
Yeah, absolutely. I found the same thing. Typically, indicas are going to be heavier in myrcene, linalool, terpenoline, depending on the THC content. And it all depends on what order. Whereas sativas are typically going to be heavier with limonene, pinene, and such terpenes. One caveat I do want to throw out there that I forgot to mention is that if you're dealing with anxiety and if you're looking for a daytime product, most people will stay away from a sativa. However, sativas with just limonene and very little pinene or zero pinene are great for anxiety during the day. However, limonene with pinene can induce anxiety because pinene is very energetic, whereas limonene is just uplifting without that energy.
Mm-hmm. Yeah, that's a good point. Maggie, any comments on your side?
Just to add on, yes, they do typically have a theme because a lot of these terpenes are either going to be sedative or in relaxing or more uplifting and focusing. And so you do see a commonality with what you'll see in sativa and what you'll see in indica.
Sure, that's really great. Let's jump to the next question. It says, I have multiple health issues, but interstitial cytosis causes most of my pain on a daily basis. Which terpene would you recommend? I'm not familiar with your exact condition, but I do know that if you're taking a look at addressing pain, that's where you want to take a look at, you mentioned your caryophyllines. Your thoughts on that, Manny?
Yeah, I would always defer back to caryophyllene. I'm not familiar with that diagnosis either. However, having that consultation with one of the associates at a dispensary would make it that much more beneficial for you. Describing what relief you're trying to get from cannabis rather than trying to take care of a diagnosis is always beneficial because dispensary associates are not medical professionals. Though they take pride in their field and they do their studies, they figure out what they're trying to do. They can't offer medical advice. It's just against the law. So just tell them what symptoms you're trying to treat, and they will be better able to assist you.
Yeah, and that's one of the reasons why we put together that chart that has all the symptoms, because once you identify the symptoms, you can really take a look at the terpenes that help you there, irregardless of what your particular condition is. We know that it'll help in those particular areas and it'll help you with your pain. But again, I would lean towards something with caryophyllene, and also don't forget myrcene, because I think it'll help in this particular condition. Again, I'm not an expert on it, but just looking at terpene profiles, and you mentioned pain, that kind of triggers the answers that I was just providing you there. Next question is, my RAMD prescribed indica gummies to help sleep, but makes me feel like I drink lots of coffee and can't sleep. What do you recommend instead? It sounds like he gave you a gummy that doesn't necessarily, it's maybe high in THC, but doesn't have doesn't have any let's just say it doesn't have a lot of terpenes in it. I would bet that the gummies don't list the terpene profile and probably are high in THC. Your thoughts on that, Manny?
Yeah, so what this is also leaning towards the paradoxical effect because typically, unless you're holding that gummy under your tongue for a long period of time, if you just chew it up and swallow it, that terpene profile is getting destroyed anyway by the stomach acids. And that's
Yeah.
why it should be more indica-like and help you sleep. However, again, it sounds like you have a paradoxical effect. So what I would personally do or recommend as an advisor is to try something that's cost effective in a sativa category and see how that makes you feel very low and slow, a micro dose. Best ways would be probably buying a small bottle of tincture and keep it under your tongue and see how that affects you.
Mhm.
It does happen. If you normally drink coffee and it puts you to sleep or Benadryl and it wakes you up, you have a paradoxical effect. You're just unique, is all that means. And you just need a little extra TLC getting a consultation from an associate.
Yeah, that paradoxical effect is the effect where it has an opposite effect of what you normally would expect. That's what you're really meaning by that. And I think that, not having the gummy may not, your doctor may not know what terpenes are in there. That's probably one of the issues. And I think making sure, like you mentioned, try a terpene, try a tincture, excuse me, and try something with a sativa might, especially if you have the paradoxical effect going on, might make a difference. Your thoughts on this, Maggie?
One other option to try is something that has a ratio effect. So something that's either a 1-to-1 THC to CBD or the 5-to-1 THC CBN. Those might have a better effect for you at really inducing sleep and relaxation with an increased entourage effect. So getting all of the cannabinoids pairing up together and giving you an even greater effect than just
Right,
THC alone.
right. That's a good point.
One thing I'd like to point out, Mark, is on that question, and as we just suggested, doctors are not prescribing marijuana to anybody in the state of Florida. They are making
Mhm.
recommendations. And pre-COVID, they used to put in very specific recommendations in the notes. That's no longer happening as consultations aren't happening the same way they were pre-COVID. So
Yeah.
you're able to go back and shop and get those consultations, and you want to be specific so you're not wasting money on products that you'll probably never use later.
Yeah, that's a good point. That's a good point. Let's jump to the next question. What are the best terpenes? What are best terpenes used for Alzheimer's? That's an interesting question. Manny, you want to check this one? Or you want me to take it?
I'll start off. One of the things I like to use or recommend for the patients I work with is high CBD products with a lot of what's the word I'm looking for? Limonene or pinene, depending on the situation. Uh,
Mhm.
and and if they need THC, I would go up as high as a 1-to-1 product. I wouldn't go too much higher than that, just because of the mindset and you always want to go low and slow. So
Sure.
limonene, pinene during the daytime. If it's more afternoon, I stick with linalool or terpenoline, which is normally a relaxant, but mixed with THC can act as an uplifting agent. But it's very good for focus and stress, memory, and everything that will come along with Alzheimer's.
Right. And I think having a ratio product where you have maybe a 2-to-1 or a 4-to-1, even an 8-to-1 can help a lot with Alzheimer's because what you're trying to attack is the plaque that's being formed on the inside of the cranial skull. And really what you're trying to do is you're trying to reduce that and be able to address it. You're not going to get rid of or cure Alzheimer's. What you can do is you can slow it down, stop it, potentially reverse it just a little bit. There's been a lot of breakthroughs in the research on Alzheimer's, especially recently. The Israelis have done a lot of work in this particular area. As you know, here in the United States, being a Schedule I drug, we have very little research done. But the research on this particular area, both in Israel and also in Canada, have been really interesting. So take a look at that. It is a very effective. Cannabis is very effective for Alzheimer's. Last question we run into here is there any information for PTS terpenes? Maggie, do you want to tackle this one? Because this is very important. PTS, cannabis is famous for helping with PTS. The question is, what type of cannabis do you use?
Right. And I guess that really depends on the specific symptoms that this person's experiencing. Typically, you're going to want to look at the common terpenes like limonene, linalool that help relax and then elevate the mood. So increased happiness, but also calming. And then depending on what other symptoms and experiences they're having, you can look at the that all the other terpenes really can come into play depending
Mhm.
on what their specific need is.
Sure. That's really great. Manny, you've had some experience with PTS. Why don't you chime in? This is like right up your alley.
It is. This is one of the ones that I've had to deal with when I retired from the military, as well as when I was in the military. And it's a little bit tricky because PTS, a lot of people think PTS is just I'm waking up with night terrors, horrors, I can't be around fireworks, sirens. Although all those are part or can be a part of it, it can also be not just anxiety, it could be depression, stress, and so many other things that fall under PTS or PTSD. And
Right.
what I found was beneficial for me starting was high THC products that were hybrid in category, so high in caryophyllene, maybe a little myrcene for relaxation during the daytime, limonene. However, you also want to be able to confront what you're trying to deal with. You have to deal with some truths that you have to either accept or determine when you're going to accept them, because this is a gradual thing that you need to journal, you need to keep a track of. And what worked for me in the long run was switching from just limonene to adding pinene, which is more energetic, which
Mhm.
at first was unsettling, but it also helped me come to focus and realize, okay, this is where I want to be. So this is a journey. And the associates at dispensaries are there to go on that journey with you or pass along some associates that will be there when they're not there. And you have consultants like myself and people like you, Mark, that are there to help. So definitely a journey, just like cancer and other ailments. Take your time, but I would go with limonene during the day, linalool in the afternoon. If you want to sleep, myrcene.
Yeah, and it's very, very effective. So listen, we've covered a lot of the questions. I do want to wrap this up. I think I want to also point out, and I think we went over this before, but I'll kind of mention it again. You have a great webinar discount area. Is that correct, Amy? Or Maggie, excuse me.
Yes, and I just realized I have a little bit of a typo there. So it is $25 off. So it is an extra 25 off with no minimum there that will have available with that discount code you can present to your bud tender. It's available until July 5th for one-time use. You can also scan this QR code here and sign up for our loyalty program. And if you sign up through this QR code here today, then you'll get an additional $10 off that you can use at any point.
That's great.
I'll also be picking 3 winners at random, and you'll receive an email by this Friday. So just keep a lookout for that in your inbox in case you win.
That's really great. Well, listen, thank you very much. Manny, let's talk a little bit about your project for a second, if we don't mind. I know a lot of folks have asked, what is your blunt joint?
Yeah, so it was a play on words, blunt being that we're bluntly honest, and this is the joint to have these discussions and feel comfortable about. And all we provide is resources, official resources, as you can see some of them there on the slide, to educate not just consumers but our community. Talking about police departments, I do sessions at library, open doors, so people could come and ask questions. We talk to mayors. We go to Tallahassee and we kind of lobbying, try to get understanding of the politics as well. So we're just here to help and pass out that information. And myself and Angelo, if you ever go to the website and look for information, you'll see it's all free, and we're both here to kind of get out there and help people find their better quality of life and help others understand why and how people are getting that better quality of life.
Great. I think that's great, Manny. And thank you very much for setting up this organization and doing that. I know a lot of folks go to the dispensaries and get a consultation, which is something that I really recommend doing. But I know sometimes when you want to get personal and really dig down into your particular condition, having a resource like this really helps. I know your website, which is thebluntjoint.life, is a place they can find you. Is that correct?
Absolutely. And on that site, again, most of the references are going to be from the Office of Medical Marijuana Use officially, Medical Marijuana Use Registry. And then as most people will know, if they haven't already, as they dive into this journey, there's a lot of rabbit holes out there. There's a lot of information that may not pertain to you. All good, but it may not pertain to you. And that's what we're here for, to help you navigate that. The clinics, dispensaries, you name it, other than cultivation, that's not legal at all yet. So we kind of leave that off the table for now.
There you go. Well, thank you very much, Manny, for doing this. I do want to wrap up the webinar tonight by mentioning, as I mentioned in the beginning, you will get a email from us that'll give you a copy of the video. It'll give you a flip book of the presentation, and then of course you'll be able to access all the Q&As and all the videos on our YouTube channel, Marijuana Aware, YouTube/Marijuana Aware. Please like and subscribe. We really would appreciate that and help us build our channel. More importantly, our goal is to really help you get your life back. Just if we can just have one person watch this webinar tonight and get their life back, we've accomplished what we wanted to accomplish. So closing comments. Let me start with you, Manny. Any closing comments?
I just wanted to thank you, Mark, Maggie, for allowing me to participate with you both. It's always a pleasure. I love giving information out. And if there's anything I could do for either of you or the community that's watching, please feel free to reach out to me, thebluntjoint.life or thebluntjoint420@gmail.com. I'll be happy to assist. Thank you all for participating.
Thank you, Manny, for helping us tonight and for what you do. We really appreciate it. Maggie, any closing comments?
Well, thank you so much, Manny, and thank you, Mark. I really appreciate you both. I agree. Thank you, everyone here. It was a great conversation and very insightful. And again, if you guys have any, if you'd like to try us out, Air Cannabis Dispensary, we have about 64 locations across the state, so hopefully one near you. Thanks, everyone.
And I also want to thank each and every one of you for tuning in today. Please join us. Check out our YouTube channel, Marijuana Aware, and listen. Hopefully you can get your life back, and this has helped you quite a bit. Have a good evening. Have a good weekend, and tune in next week to find out more about the Florida regulations. What we're going to do is we're going to dive down and really help you understand them. So thank you very much, and have a great weekend, and have a great night.